Once you receive your CAR T-cell therapy, you must be monitored closely for treatment side effects. You might stay in the hospital for a couple weeks after your CAR T infusion to be monitored for these side effects. You will need to stay in the Omaha area for at least 4 weeks after your infusion. There are 2 major side effects that are important for you to know: cytokine release syndrome, or CRS, and neurological toxicity, or neurotoxicity. These effects may start during the first week after infusion and may go away within 1 to 4 weeks. Sometimes they may take longer to get better. The CAR T cells may cause side effects that are life-threatening and may lead to death. Signs of cytokine release syndrome include fever, fast heart rate, low blood pressure, trouble breathing, headache, nausea, or body aches and pains. Neurological toxicity may be caused by cytokine release syndrome and can make you feel confused or disoriented. You may have difficulty knowing who or where you are or recognizing family or friends. You may have difficulty speaking or show physical symptoms such as a blank stare, tremors, excessive sleepiness, seizures, or seizure-like activity. These symptoms will most commonly occur while you are in the hospital, but there is a risk of these symptoms appearing after your discharge. Due to this potential side effect, you cannot drive for 8 weeks after you've received your CAR T cells. Your labs will also be monitored frequently to evaluate your blood counts and organ function. It is very important to keep all scheduled lab appointments. CRS and neurotoxicity can be frightening for you and your loved ones. With early recognition of symptoms and appropriate care, there is a good chance of recovery. It is extremely important to report any of these symptoms immediately. You will be given a wallet card with information regarding your specific CAR T-cell treatment. You must keep this with you at all times and notify every healthcare provider that you see that you have been treated with CAR T-cell therapy.
CRS, as we've learned more and more about it, really is likely dependent upon the amount of disease that the patient has going into the CAR T-cell therapy. So potentially the bulk of the disease may predict the severity of the CRS that could occur. We are trying to employ different strategies and to mitigate the risk of high-grade CRS. So if you're going to have CRS, we try to keep it kind of in the fever stage. As we've learned over time that with that treatment, it may not compromise the efficacy of the CAR T cell in itself. So really looking at strategies to try and keep that high grade or that grade 3-4 cytokine release syndrome, where people are requiring blood pressure medications or spending time in the ICU on high flow oxygen and whatnot. With regards to neurotoxicity, typically this happens often with CRS, but it doesn't have to. Sometimes neurotoxicity can be as simple as people being unable to say, that red thing that hangs from the tree, and they can't come up with the word apple, all the way to where people can't speak and they can look and follow you throughout time. People can go into a coma-like state for a certain period of time also, but that's in the situation where the severity of the neurotoxicity is quite severe. We do have a team in place, and we do prescribe prophylactic medications to prevent seizures from occurring if CRS were to occur, because of the risk that neurotoxicity could come kind of after the CRS.